Did you know that 1 in every 3 women in the U.S. experiences urinary incontinence? And an astounding 13 million U.S. women suffer from stress urinary incontinence, involuntary urine leakage when laughing, sneezing, exercising. Women also experience pelvic floor conditions that can make life challenging and uncomfortable, but yet they suffer in silence. However, despite the prevalence of these conditions, they are rarely discussed and they often go untreated. We're here today because there are solutions, both surgical and non-surgical, and we will discuss these life-changing options on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, and thanks so much for joining us. I'm Jane Hansen. Today's show is for women who are suffering in silence. Perhaps you think that the urinary incontinence you are experiencing or your pelvic floor condition is a natural occurrence after childbearing or maybe part of the aging process. Well, today we're going to discuss this subject as we welcome Dr. Scott Press, a urologist board certified in female pelvic medicine and reconstructive surgery. Welcome, Dr. Press. It's good to have you here.
Thank you.
Okay, why is this the big secret that women don't talk about?
Well, I think it's embarrassing. Women have this problem, and a lot of times their mom might have had the problem, their grandmother might have the problem. They just kind of told them this is the way it is. As you get older, you just have to suffer with this, and they think it's the norm. And only when they start talking to other people who might have had something done and they find that there is something to be done for it, they look into it.
It's so interesting because women tell each other about everything, but yet they don't discuss this.
This is one thing that they generally don't discuss. They start to discuss it when it's fixed, and they're extremely happy about that. But before it's fixed, they tend to not.
Well, so what is it? What is female pelvic floor conditions? What are they?
Well, there's a variety of female pelvic floor conditions, but the one that we're talking about for incontinence that I treat mostly is what's called stress incontinence. Stress incontinence is leaking of urine when you cough, laugh, pick up your child, or run, do any physical
Exercise,
activity.
All that
any
sort
physical
of thing,
activity. Yeah. That could happen if you're somebody who's 30 years old running a marathon, or it could be if you're 70 years old and you're just trying to stand up, and every time you move, urine leaks. A lot of times requires pads. There's smells that are not good from urine leaking that is embarrassing. So a lot of patients don't want. They used to go to the gym, now they don't go to the gym anymore, or they're inhibited from doing a lot of things that they normally do.
I can only imagine what you don't do because you're afraid of what might happen. So, but what causes it?
What causes it is the ligaments that hold up the urethra get weak and they get loose. Now that could come from childbirth. Very frequently after a child, vaginal delivery, and even not vaginal deliveries, that the ligaments get stretched, and the urethra tends to get what we call hypermobile. So when straining, the urethra tends to push down, and the sphincter muscle that holds the urine in is not strong enough to hold the urine in, and it just leaks. Is
there anything you can do to prevent that ahead of time?
Well, a lot of it is genetic. There's a predisposition to it. There are things you can do that are non-invasive to try and build up the muscle. So if the ligament is weak, you can try and build up the muscle around the ligament to hold in the urine. And that's what we call Kegel exercises. You may have heard about, where you try and stop and start the stream. That is muscle retraining type stuff.
Okay, but so let's say that your problem is beyond that. What kinds of procedures can one have done? I mean, is there a wide variety of things?
Historically, there have been lots of different procedures that have been tried. Unfortunately, a lot of them have gone by the wayside. When they go by the wayside, it's because they didn't work very well.
Right.
In the past 10 years, we've developed a thing called a mid-urethral sling, which is a tape procedure with a mesh procedure where we are able to put a tape underneath the urethra, so when the patient strains or the urethra wants to drop down, if this is your urethra, it wants to drop down, there's a sling underneath that holds it and prevents it from leaking.
Is this what we call your 7-minute sling?
Yes.
Okay, so Dr. Press's 7-minute sling procedure is trademarked, and it's a treatment only available at St. Charles Hospital. Before we continue to talk, let's take a closer look at how this simple procedure works and how it can change your life for the better. Let's take a look.
Well, 7-minute sling is a procedure that obviously takes 7 minutes to do, but it can change people's lives. And what it is, it's a sling procedure for incontinence. With the 7-minute sling, you come in, you go home the same day, come in the morning, home before 12 o'clock, and when you leave the hospital, you're dry. So where it takes a while to develop this problem over time, gradually, it's instantaneously fixed. And people don't realize how much it affects their life until something is instantaneously fixed.
I saw a few urologists before getting to Dr. Press, and once I found Dr. Press, I found out that I didn't have to suffer through this for the rest of my life. I had expressed to him that I was looking to not have to take medication every day, that I was looking for other options, and that's when he brought up the 7-minute sling. It seemed like when I saw Dr. Press, he knew exactly what I was going through. Whereas whereas the other doctors, I felt like I had to show up with a list and kind of explain what was going on. Dr. Press he got it. I was a bit nervous. Because I had never had a surgical procedure done before. So that was one thing I was nervous about. But I knew that after dealing with this for so many years, if I wanted things to change, and my lifestyle to change, that I needed to take care of it. So I guess the need for the change overcame the nervousness. But Dr. Press took a lot of time and was very explanatory, went into detail as far as the procedure, what to expect, what not to expect, recovery. So he kind of set my mind at ease. The staff at St. Charles was very good. My anesthesiologist really put my nerves at ease, because that was my biggest nervous concern, was anesthesia, because I had never had it before. But I can't imagine ever going back to living that way. I walked into the hospital about 7 o'clock in the morning, and I was out by 10:30, 10:45 in the morning. After recovering from the anesthesia and the recovery room and everything. I felt great when I left. Came back from my weekly checkup after the procedure was done, and then after another 3 weeks, and my life's been different since.
It's kind of like an old wives' tale. As you get older, this is going to happen to you, and it's a natural thing. And people, a lot of women don't think to even ask anybody about it, because maybe their mom had it and their grandmother had it, and they never had anything done. They just figure this is just the way it is, and you have to suffer like that. It's only when they start to educate themselves and they see that maybe someone else had something done that they ask the question.
My perception was that this happened to older women, seniors, and it's not. I actually, now that I talk about it, I know more and more people the same age, same predicament as me, with young children, active lifestyle, and working full time. So it's not just something that occurs in older women. It's something that definitely occurs in younger women, and there's no reason to have to live like that. My entire life has changed since September 12th.
When a patient comes back after surgery, I'm basically looking at their face when they come in, and they always come back smiling. I get the most kisses and hugs from doing these procedures than anything else. And routinely, patients tell me that this changed my life. It's amazing. They can't believe it. And most of the time is, I can't believe I waited so long to get this done.
Wow. So the procedure really only takes like 7 minutes. Is that true?
Yeah, the procedure takes 7 minutes for me to do.
And now Trish can go on the trampoline, and for something that she lived with for so long, it's kind of amazing to think about.
Well, it's amazing because it takes them a while to develop this over time, and it's a very incremental thing. You don't realize you're having the problem till all of a sudden one day there are things you can't do that you've been compensating for, and all of a sudden that you can't compensate for them anymore and you can't do them. And then one day you go in you have a procedure done, and you go in the morning, and before 12 o'clock you go home, and you dry when you leave the hospital. So it's instantaneously fixed.
And are there any after effects or side effects? I mean, soreness, anything like that?
There's some mild soreness, but I have lots of patients who don't believe I did anything. You know, they come into the recovery room and they think that the procedure hasn't happened, and you have to tell them that they had a procedure done. But when they go, the first time they cough or sneeze and nothing comes out, and they cross their legs expecting something to happen and nothing happens, they're always very happy.
And is it a permanent fix?
Well, it's permanent in the sense that it's as good as we can get, but I'd say 85% at 10 years are still dry. Mm-hmm. If it does recur, we can redo the sling and get the same results.
So people are just not, I mean, women are just not really aware of what this is, what's going on, and how to deal with it, right? They're very accepting instead of recognizing that they can do something.
Correct. They tend to just compensate and say, keep going. You know, they want to keep doing their thing, and each time it gets a little worse, and they say, okay, maybe I won't go to the gym. Okay, maybe I won't run. And so a lot of times it's subconscious. They don't even realize it, because when they come back to my office and they say, I'm going to the gym now. They lost 10 pounds, or all these things that they weren't able to do before. That's where it changes their life. I get the most hugs and kisses from slings, because the patients come in and it's changed their life.
Do you think there are, I know you do 50, 60, 70 of these procedures a year, do you think that there could be a lot more women out there that need this?
We're just scratching the surface of the patients to see, because most patients don't come in for treatment. But the patients that do come in, they are the biggest advocates for getting it done, because they're happy and they want other people to be happy too.
Does it hurt, the process? I mean, you're under anesthesia, full anesthesia.
The procedure, I really don't, patients most of the time don't need more than the Motrin afterwards. Mm-hmm. So no, it's really not painful.
Covered by insurance?
Covered by all the insurances.
Wow. So any advice about this whole issue of pelvic floor health, just in general? I mean, we're talking about a pretty dramatic step to take, having real surgery, but any other advice for women, younger women, et cetera, listening right now that you could say, here's some steps you can take so that you may never have to deal with this?
Well, I think one of the big things is, I mean, obviously people are going to want to have kids, they're going to keep having kids. Mm-hmm. But if you can keep yourself in shape, and you can try and keep the weight off, weight tends to put a lot more pressure on those areas. So even if you're prone to developing stress incontinence, if you can keep the weight down, that'll help maybe take a little longer for it to develop.
Well, it was very nice to meet the inventor of the 7-minute sling procedure, and it's just amazing that this is a subject that has been kept so secret, and yet it seems like it would be so simple. So, and St. Charles, again, is the only place that's doing it currently.
Correct.
Okay, very good. Thank you, Dr. Press.
Thank you very much.
Very nice to meet you. We're going to have a quick break, and then we'll be back with more CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Our pelvic floor is an important muscle, and like any muscle in the body, it can be weak, but it also can be strengthened. Speaking to your doctor can help to change your life, and that's exactly what our next guest, Susan Rangone, had the courage to do. And she joins us now to urge us not to sit in silence, but to speak out. How you doing?
I'm doing great. Thank you.
Dr. Press you're one of the patients who hugged him and told him he'd changed your life.
Absolutely. When I went back for my first follow-up after 2 weeks, I mean, I was smiling ear to ear. And, he said, this must be a good sign. And I said, it certainly is.
So tell me how this happened, because you were truly one of those women who was suffering in silence.
Yes. Didn't want to discuss it with anybody. Thought that it just was the norm, to have this happen, whether it be coughing, laughing, walking, anything. And it was years and years. And then finally got to a point where it became so necessary to seek treatment, because I said, this is enough.
You were jumping in the kitchen with your grandson.
Yes, yeah, and just everything let loose, had to go upstairs, shower. I came down, I said, that's it. So, and that's when I then followed up with my own doctor, and then did this, the different routes going along, ended up in Dr. Press's office, and successful story.
Now, you didn't even tell your husband
No.
what was going on?
No.
Nobody knew
Nobody.
you had this problem. For how long?
Years. Years.
What
Over
was
10 years. Because I accepted it as this must be part of life to have this happen and everything. But then as it got worse and worse and worse, and it was getting worse, where, you know, what you had to do to control it and take care of it every day was getting harder and harder.
Wow.
And then I said, that's it.
So now, here you are sitting talking about this on television, a subject that you didn't talk
I
to the
can't
most
believe it, right.
intimate family
Yes.
members. So what is it that made you actually want to speak out?
Now, because of this success, I mean, I didn't even think that this was going to be a success afterwards. Even after it was done, I was like, okay, all right, do I have to wear anything? Am I going to be all right? Whatever. And realized, oh my God, total success. Now, when I'm speaking to my friends or whatever, I tell them, oh, do you know what I had done?
You just tell them?
Yes. And, you know, and then they will go, oh, you know, whatever, maybe they might have a few problems or something else, because it's such a success. And why wouldn't anybody seek treatment now for it? I didn't know that there was even this treatment available.
Right.
I was just going to a doctor saying, help, help.
And even your first regular doctor didn't really know what could be
No.
done, right?
No, he sent me to a urologist. You know, he said, all right, this is what you need to do. Because I didn't really even discuss it with him, you know, until I had it. You know.
So are you discovering that as you talk to people, there are more and more and more and more women? That's
Yes,
like you almost become
they
this
don't have it
cheerleader?
as severe as I do, but they have symptoms. So I said, well, when those symptoms get worse and worse, seek help and seek Dr. Press.
And
Yeah.
now, so the procedure itself, you were under anesthesia.
Yep.
You truly
Outpatient,
okay. You were in a couple of hours.
couple of hours, went home by 1 o'clock, was on the road going home and everything. And I took it easy for 2 days because I was so afraid that this was not going to work, and I wanted this to be such a success. So 2 days I took it very easy. My husband like pampered me. I stayed upstairs.
Ooh,
He
that's
brought me
nice.
a bag with lunches and everything, and he wasn't going to be there. It was just wonderful. And then, you know, slowly got back into the routine. Didn't have to wear anything. I wore something, you know, in the beginning because I was afraid, and then realized I don't have to wear anything. I don't have to wear. I can cough and nothing's happening, and everything.
So what can you do now that you couldn't do 6-8 months ago before you had this surgery?
I can laugh. I can cough. I can jump if I wanted to, but I mean, I can walk. I can be driving in the car and not have a cough come and have an accident. None of this happens anymore.
So your life
I am dry.
is a new slogan.
I'm sorry, but that's what it is.
But so at the end of the day, your life for something that was so simple to have done has changed.
Has changed. I mean, completely. Just completely. I can't recommend it enough to anyone who might have this problem and who probably does have this problem.
And the more you speak out, the more help you're going to be to other women.
Yeah, yeah. So I'm hoping.
Yeah.
I'm hoping. Just do it. Don't be afraid. Just do it.
Susan, thank you so much.
Thank
You're
you.
a treasure. It was a pleasure to have you here today. We're going to take a break, but don't go anywhere because there's more as CHS presents Lifestyles at the Heart of Health right after the break. Welcome back to CHS Presents Lifestyles at the Heart of Health. According to our next guest, about 20% of patients experience mixed incontinence, a combination of stress and urge types. Joining us now is Dr. Alfred Cohan, a St. Joseph Hospital affiliated urologist, to speak more on this whole issue of urinary incontinence. Welcome, good to have you here.
Thank you, Jane. Good to be here.
So tell me, what is the difference between the stress and the urge incontinence?
Well, as Dr. Press explained to you before, stress is the one that occurs generally with any kind of activity. So jumping up and down, laughing, sneezing. Urge is the type when you get a sudden onset of this pressure that you have to urinate and you can't postpone it. So you must essentially stop what you're doing and visit the bathroom.
And hope you make it.
Hopefully you do.
So what's the turning point between this being something you can live with to actually needing to see a doctor, in your opinion?
Again, the bother factor, which is really what you're talking about, is individualized for every patient. So many patients change their lifestyle. They avoid drinking, for example, coffee or a lot of liquids, and they try to visit the bathroom a little bit more often to prevent themselves from having these episodes. But eventually comes a time when those personal modifications don't necessarily cut it anymore. And at that point, they start reaching out to hopefully their doctor or appropriate urologist looking for results.
So what's the first or the second thing that you might do to treat this?
We always talk to patients about behavioral modifications. So the same thing that I mentioned to you, like, limiting your liquids late in the day, avoiding things that may irritate your bladder, like coffee and alcohol, or the predominant initial steps. Once those fail, then we start moving on, in addition to pelvic floor exercises or Kegels, into medical realms. And we're talking about a variety of different medications that are available. There are oral medications. There's an over-the-counter medication that was approved by the FDA about a year or so ago. And then eventually, if medication doesn't work, then there's additional secondary options.
Does medication usually work, though?
Initially, yes. The overall success rate with medications on the order of about 40 to 50%.
Ooh.
The big problem is there's a tremendous amount of side effects.
Like?
So dry mouth and constipation are main two forms of them. And none of us, as we get older, want that.
No kidding. Okay, so let's move on from then the behavioral modifications and the medication to, you've got a couple of other things that you do, treatments.
Right. The secondary options are non-medication types. Either the patients can't tolerate the medications or the efficacy is gone. And then we start moving on to 3 main FDA-approved options. And those are, in no particular order, involves you can actually use botulinum toxin or Botox.
Botox?
Yeah, that makes your wrinkles go away. You can use that in your bladder. And
What does that do?
it makes your bladder wrinkles go away.
Really?
It actually calms your bladder down to the point that these urges will disappear and you're able to hold your bladder and make it to the bathroom.
But people who use Botox for wrinkles in their face have to have it redone every few months or so. Is that the same thing?
That is correct. There are different types of muscle layers in the body, or muscle types, which I should refer. So when you inject Botox generally in the face, it will, on average, last about 3 to 4 months. Bladder is a smooth muscle, so it tends to retain the injection of the Botox in there a bit longer. So at least on the clinical results, when we use this in patients who don't have a neurologic problem affecting their bladder, on average, the success rate is approximately 6 months.
Okay, then you also talk about another one being electrical stimulators.
That is correct. You can almost, for lack of a better term, use a pacemaker for the bladder. So this
You
is
put it in, where do you?
It actually doesn't go into the bladder. It is used in conjunction or nearby to the nerves that go to the bladder. And by sending a small signal to those nerves that go into your bladder, it actually can calm the bladder down. It actually equally works for situations where your bladder doesn't work, and it can get it to start working as well.
Wow. So, but where exactly do you use the stimulator?
The stimulator is placed in your back, in the lower back area. It's generally about the size of a silver dollar, so about this big, and has a little bit of a small wire that is attached to it. And the wire goes to the nerve that goes to the bladder. It is not in your spine, and it's not in the bladder itself. It actually sits right underneath the skin.
But didn't you say you can also use it, put it on your ankle?
Yeah, there's a third kind it is not an actual implant, that one. That's an office procedure that is done on a weekly basis, generally for about 10 to 12 times. And by stimulating the nerve, you can actually achieve the same results.
Is that what's called interstim?
The interstim is the one that you put
On
in
the
the back.
Okay.
The one that is in the ankle is called PTNS.
Okay, and they work?
They work, yeah.
And long term?
Generally, the long-term success rate is actually quite high. For interstim, we're talking about 70% success rate, and the only downfall to it is that every few years or so, when the battery runs out, you have to change it.
Got to change the batteries.
Pretty much.
Okay, well, on that note, I'm going to invite our other guests to come back, Dr. Press and Susan. Please come back up here so we can wrap things up a little bit. I guess when you talk to your patients afterwards, I mean, how do they respond?
Well, the first thing that generally, especially my women patients, say about use of Botox, the first response always is it going to make me look younger? And the answer is it's going to make your bladder look a lot younger than what it used to be.
And that's what you're here for.
And that's what I hear.
So you two know each other, and this is one. So give him a big
We're
hug.
a pair.
He's
Yes.
clearly
Yes.
made your life a lot
I
better.
gave him a big hug afterwards. Yes, absolutely.
Any last words for women out there watching?
I think the most important thing is that if you're suffering and you can't do what you want to do, there's treatment, and it works quickly. You come in, you go home, and you're fixed. And I think that's the most important thing, and you can get on with your life.
Get back to having your life.
Yes.
Having your life
Getting
back.
it all back.
Getting
Yes.
it all back.
Getting it all back.
Thank you all so much for being here. It was a most interesting conversation. And to all of you, thanks for watching. For more information or to schedule an appointment with Catholic Health Services, you can call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us today. I'm Jane Hansen, wishing you goodbye and good health.